Okay, it is connecting. We are not there yet, but it's getting there, I think. Okay, we are on. So, hey, Jasmine, I'm so excited that you volunteered to be one of the people who come on to receive a live in real time resume review. I received your resume that you sent over last night, but I do have some questions before we get started, just so I had a context that I need to understand what's going on. First, do you have any specific questions about your resume that you want me to answer so I can ensure that I answer that while I'm giving you other information?
Okay, so I think I've had my resume done had it done over quite a few times. And so this is the latest one. So with me just now finishing school, maybe just 2 years into getting my master's, which is not in social work, it's in public administration. So I don't have a lot of work experience. So I don't know if my resume shows for the jobs that I have had, if they show enough of what I have done already, if that makes sense.
It does. Okay. So that's a good segue into my next question. Tell me about where you have worked
Okay.
in the past.
So I was a teacher. So I taught a life skills class to special education children, 9th through 12th grade, taught life skills. I did that for 2 years. After teaching 2 years, well, about a year and a half, that's when COVID happened. So we were at home. Came back that following year, still taught that life skill class. After leaving the school, I actually worked for United Healthcare, and I was a special needs care advisor. And so, would you like me to go into detail about that?
Yes.
Or okay, so with working for United Healthcare as a special needs care advisor, what I did, I worked on a dedicated team where I worked with different families who children had quite significant disabilities, who often were in the hospital a lot, or just had high claims and things like that. I basically worked with them on claims if they have issues with their claims not processing, if they needed to know what to do, how to get to this hospital, just basically being their support system in the healthcare system. So
Oh,
that's what I did there. I worked for United Healthcare for a year and a half, and now currently I work for Molina Healthcare, but I work on the managed care side through care management, and I work with Medicaid. Where when I was working with United Healthcare, it was all self pay, self-paid through employee pay rather, where now I'm on the Medicaid side of things. And so that's a whole different ball game coming from, employee insurance to now Medicaid. And so while working with Medicaid, I do work for the state of Mississippi, and I my title is called a community connector. And so as a community connector, I have a caseload that ranges anywhere between 50 to 80 members, and it's elders, children, just families all together that's on Medicaid. And so as a community connector, I provide resources to these families, just let them know what's available in their community, again helping them navigate the healthcare system, just basically what I was doing at first. And like I said, from just the difference of going from self-pay to Medicaid. So that's the main difference between the two insurance jobs.
okay. I love that. Um, what's your bachelor's in?
Social work.
Social work. So I'm gonna ask you two questions because
Okay.
when you went to go when you hit apply on your BSW degree application to say I'm going to get a bachelor's of social work, how did you envision using that degree?
So I always wanted to work with kids. I always wanted to work with kids. I always had been into education, but I know I didn't want to be a teacher. But quite ironically, still ended up in the school system teaching life skills. But when I went for my bachelor's, that's what I knew. I didn't want to do the CPS thing. Didn't want to do that at all. But I knew I wanted to work with kids somehow in the social work segment.
And when you chose to go get your public administration master's degree, how did you envision using that?
So at first, I was going to get a dual degree. where I was going to get my master's in social work and my master's in public administration as well. However, the school that I went to, I did not know that they did not offer that. So that was my main goal at first when I was initially going back for my master's. I wanted to do both of those at the same time. But with getting my master's in public administration, a lot of the things, well, I come from a small town and I am in Mississippi. And so a lot of the things that I I felt like that we needed in our town, I wanted to advocate for that. And again, goes back all the way to education and the kids. I just can't get away from that. I wanted to advocate for them. So I wanted to get into policy to bring forth some of the things that I knew that the kids were going through and that they needed around.
Okay. Are you still passionate about youth, students, kids?
Yes. Yes, so I'm the co-founder of a youth organization here in my county, and it's called The Hive. And so we mentor girls ages 6 through 21 years old of age. We're just 2 years in right now, but that's what we do. I enjoyed. I like working with kids because a lot of what I went through, I was a teen mom. I had my daughter at 16. So a lot of I didn't have a person to be there for me. And so I try to be that for the kids. So
And that's going to be my question. What is the biggest issue you see them going through that you are most interested in?
not having someone to talk to, the kids that go through a lot, not being able to talk to their parents and stuff like that, and just having somebody to connect with. I think that's one of the biggest things that there is.
Yeah, so that's why you have your organization on the side because that's really what you
Of
want to do in
course.
your career. So help me understand. So when the original goal was for the MSW MPA degree,
Hmm.
was that because you were envisioning using that degree to have your own organization or be the leader of an organization?
Yes. Hmm.
So, what is your biggest issue with getting a job where you're working in a youth serving organization? How do we end up in medical social work? I'm gonna just call it that.
Yeah, that's what it is. A job, because I mean I had been applying, couldn't get a job anywhere, and where I am, the jobs are just lackluster. They're not here, and in order for me to get a job that I want to do, I would have to move, or I'm just not finding the jobs, and it's not available to me in my area.
I'm Googling where you live. I see it on your resume. So there's no major cities near you anywhere?
No, so the nearest Walmart, I would say both ways, is about 45 minutes, 30 to 45 minutes from me.
Okay. What types of jobs have you been applying to recently to make you okay? You said that your biggest issue is you feel you don't have enough experience. Okay.
Hmm. Yes.
What are the jobs you've recently gone for to make you determine that's your biggest issue right now? What have you been applying to?
I've applied to like compliance type jobs. I've applied for advocacy type jobs as well through my company, and not just through the company that I work with, other jobs that I've saw on LinkedIn and things like that. And I think that's what I'm thinking. I can't say for sure that it's just because of experience, but I just feel like I don't, like, on my resume, it don't show enough of the things that I have done.
Yeah. So your immediate goal right now is to get a compliance job, preferably in your organization that you're already working with.
No, not yes and no.
Mhm.
Because not saying that my organization is a hobby for me, but I want to have what I have, but still do something else too. I know
Your
I'm kind of all over the place.
No, you want to have your mentorship program and then work.
I don't know how I can make that make sense.
Okay, tell me again. Just say it
I'm
right.
trying. I'm trying. So I don't know. I don't know how I can explain this. So right now with our mentorship group, we're not at a place where I can just say that this can be my career.
Yeah.
I can't just stop what I'm doing right now to just focus completely on my mentorship group because it's not there. So I mean, I've been applying for different grants. We're building. We're really new. We're 2 years in. February, not February, March makes will make 2 years for us. So I'm not
Congratulations.
in a position to just quit what I'm doing to just fully focus
Yeah,
on my mentor group. And like with funding being low and government shutdowns and things like
I
that,
get it. Yeah.
I just can't do it right now.
So you just need you a job, but you can still need freedom and flexibility to have your thing on the side. Okay.
Yeah.
So the
Mm,
jobs you're gravitating toward makes sense, especially being that you live in a rural area. That's like where I used to live, a rural area. So for the compliance jobs, how you make your resume speak to that with your two jobs where you were the special needs care advisor and the community connector. Well, one, you need to take off the education teacher job for the compliance healthcare jobs.
okay.
Okay. And for your special needs care advisor and then a community connector job, you want to talk about the work that you've done that has supported compliance standards.
Okay.
So as an example, special needs care advisor, one of your bullets says consulted effectively with patients, doctors, and staff members assessing medical charts and promoting high level PF communication. What's that? PF.
Performance. Excuse me. That's short for performance in
Okay. High
medical.
level performance communication and interaction with parents with children with special needs. Consulted effectively with patients, doctors, and staff members. Why does that matter? Why do you have to consult with the parents? What is the why behind that?
What you mean?
Like for that
Why
bullet.
consulting with them pertaining to
Mhm.
that job? So in short, with working in care management, a lot of that is building that relationship between the families and then also the doctors. So that's how that plays in part with each other.
So it sounds like this is a part of like patient continuity of care. You
Mm-hmm.
have to talk with the patients and the families, and I'm
Yeah.
making something up to say Billy needs to go to therapy 2 times a week. Then you are communicating between all of these parties, but you're also educating the parents.
Oh,
So
yeah.
for that bullet, what you have is very doer focused. You need to spend like focus on what is the why behind it. The reason your job is having you do that is because it's a part of compliance standards. And the compliance most likely is around patient continuity of care to ensure that the people don't go outside of the parameters of how much their health insurance is going to pay for. You need to go to the doctor in 3 weeks. You can't go in 6 weeks. They're not going to cover that.
Right.
You have to understand explicitly what is the why behind why your job has hired you. And you are there to be the keeper, you could call it a gatekeeper, a keeper of making certain that the people do what they're supposed to be doing when they do it to ensure that it stays within compliance. So, in order to talk about that, you have to talk about the why behind it. Like, yes, you consulted with them, but you want to have a part in that sentence to say, like, to ensure that insurance compliance standards are met on a monthly basis or in
Okay.
accordance with such and such policy, regulation, and rule. But in order to know that, you have to spend some time really going back to when you started training and the people were telling you why you were doing it. Does that make sense?
It does.
Okay. So like your second bullet for the special needs care advisor, where you communicated with patients to ensure quality care and develop care plans. What did that look like? You didn't just pop in to Billy in the room with Billy and his mama and say, the plan is this. You had to go pull his file,
Mm-hmm.
read through it, You had to go look at the doctor notes. You maybe even had to go confer with the doctor and talk to him or her or them about what are you wanting Billy to do? When are you wanting him to be back? You then had to go over and talk to the head person of insurance or even your favorite person in the insurance department. How long is Billy's insurance valid? Can I get him in home care or does he have to go to the place for the therapy? Right? You're coordinating with all of these different parts to understand what is available as far as coverage for Billy to then develop this service care plan for him to ensure that it doesn't go outside of what the health insurance will pay for. And I may be off with United Healthcare, but that's what it sounds like. You are
No, no, it sounds you talking good.
okay. So I work with a lot of medical social workers in my coaching program. Okay. So you are doing all of that. So you
Mhm.
have to detail what is the process before you can go in there and have a conversation with Billy and his family.
Okay.
So you're liaisoning, you're in constant communication with those other departments. Escalated complex customer concerns for resolution. Um, you could like get rid of that bully and
Okay.
you could talk about like where you troubleshoot them because I used to work this work like a call center.
No.
Oh,
No call center. No.
okay.
No.
Well, you can't just send the people to the supervisor because they said something that you didn't like. Like you still have to triage the call. You still have to like try to help them, even though they don't want you
Mhm.
to help them. So you could be talking about in this bullet like your troubleshooting work of how you utilize policies, rules, internal policies, rules and regulations and compliance standards to help troubleshoot hard to serve customers and answer their question because you do that before you just pass it out to your supervisor,
Right.
right? Any questions about special needs? So first I would say that you need 8 bullets for the special needs care advisor.
Okay.
And they need to be high level experiences. Notice nowhere in what I just gave you as far as examples did I say manage your caseload, talk to other social workers? I didn't say none of that. I said the head of the insurance department or the representative from the insurance department. You want to
Okay.
talk about your high level experiences and your explicit use of their policies, their rules, their regulations. You're not just deciding to do these things, you're doing it based on what they say you can do within the parameters of service for your clients.
Okay.
Okay, so for your special needs, you need 8 bullets, high level. Community connector, it's the same thing because you said it's the same type of job, and I see that on paper.
Yeah.
It so like you have a different bullet on here where you said ensure that patients progress toward desired outcomes with quality care that are medical appropriate and cost effective. How do you evaluate or assess that they are making the necessary progress towards the outcome? How do you do
Okay.
that? Let's talk through it. How do you do that?
Okay, so we manage a caseload for 30 days, if longer than we do. So we make contact every 7 days. And so that's how, we make, if we see if we making progress towards the goal.
So it's just a phone call to the people.
Phone call if need be, home visit if need be, just whatever that presenting issue is, then that's how we go about it.
So that's what you talk about, how you collect data, quantitative,
Okay.
qualitative data.
Okay.
Parentheses, you could put interview, like one-on-one interviews, qualitative would be one-on-one interviews, quantitative would be looking at their doctor notes from their last patient visit, looking at the frequency of their doctor's visits versus them going into the emergency room. You want
Hmm.
to talk about your utilization of how you measure or gauge they're making the necessary progress that they need to do, and
Okay.
what is the standard for that. Is there it's got to be some type of policy or guide for you all that says patients should be doing this in order for us to deem them as making progress?
So, like I said, it just all depends on the presenting issue. So like I said, with currently with that job with Melina, so my caseload can be anywhere from children to adults. So let's just say that I have a child who's that they come in on a caseload where they were recently diagnosed with ADHD. So with children who were recently diagnosed with ADHD, we do what that's based off of HEDIS measures. So we track them over a 90-day time span. So we do our initial contact, and then after being diagnosed, they have two follow-up appointments. So we do a claims review to make sure that they following up with those two doctor's appointment all the way up to their 30 days. And then we also do pharmacy claims review, just making sure that they're picking up their medicine as well, like that. And because, like I said, that is a HEDIS measure that we have to meet for insurance quality purposes, especially the kids who have been diagnosed with
And
ADHD.
do you know who regulates HEDIS measures? Do you know who that is? Where does HEDIS measures come from? Do you know
From
that?
our department,
It come from the federal government.
NCQA, NCQA,
They come from the, so to hear you talk about HEDIS measures, most definitely, that's the macro level implication that guides your work. You're not just doing the stuff just because. So most definitely, that is the standard that you're going by, the federal HEDIS measures. You're collecting this data and then you're assessing it based on the federal HEDIS measures, and you write out HEDIS and then you put it in the acronym. Right, that's how you're connected to macro level work. And I know that from working with dozens of medical social workers. So HEDIS measures, bed count, like for health insurance, they don't let the people stay there for 500 days. They
no,
only let them in there for a certain number of days. That's why they
yeah,
have medical social workers to ensure that you are pushing the people through so they get paid, right? You are avoiding what they call disallowed costs. You are avoiding your company not getting paid for the people being there. So that's why you're having to coordinate all of this service for them to get them out of the hospital, wherever they are.
right.
So that is the why when you said ensure that patients progress toward desired outcomes, you want to connect it to the higher level reason, which is HEDIS measures. And I say, job well done. You do the HEDIS measure because many people don't, many social workers don't know that. Like I know that because I Googled it, looked it up one time working with someone. So you want to name like, because that's compliance standard. The fact that you are familiar with HEDIS and you named it to me so clearly, that means that you have read something or you read it on a regular basis.
I do.
That's what forms your eligibility to apply for a compliance job, because just so you know, every medical social worker ain't reading HEDIS policy, rules, and regulations. They don't even know what that is. So I'm telling you that because you are more than qualified to apply for the job, Jasmine.
Okay.
Okay. People don't know that, and I'm being serious. And I've worked with hundreds of medical social workers. They don't know that. And the fact that you name that so clearly, I would want you to go in and like really on Monday do a brain dump and like look around on the internet site, look through your guides. What other standards, measures, policies are you touching every day in your work? Like you're doing this because of this. And then you list those things in your resume because that shows that you are clear about like why I'm doing this and you're clear about like how I need to do it.
Okay.
People can only be here for 30 days based on making this up. People can only be here for 30 days based on HEDIS measures. So I'm going to make certain that I get them coordinated so they can move out. So then that makes you well suited to be able to go in and check the work of people in your role to say, did you do 30 days? Because based on the HEDIS measure, that's what a compliance job is. Based on the HEDIS measures, you need to have them out in 30 days. It took you 32 days. And then you're able to cite where did the people go wrong. I know that was a lot. What questions do you have?
You basically answered it. I mean, I guess I needed to, like I said, I wanted to know how that I could express more of what I have done in my resume.
identifying your high level experiences with compliance related standards. And we just did it.
Yep.
Yes, most definitely. Because you are not just a special needs care advisor. You're doing everything because there is a standard, a policy, a mandate that dictates that you do that. And so you have to clearly name where you're using that standard, that policy, that mandate, and then your process for doing it.
Okay.
Okay. The other thing that I wanted to talk to you about is that career planning for you is going to be key. That's something that I do in the Micro to Macro Career Accelerator, as well as teach people how to career plan, because being that you have your organization on the side, what's going to be important for you also is like strategic career planning and having a clear plan in place for yourself, so you know like what you're going to be doing in your career when. Because yes, I understand that you live in a rural area, but I would love to see at some point in your career plan to maybe get you a remote job doing work regarding youth, because you're building the experience in your organization. Okay. All right. Any questions for me?
No, ma'am.
Okay, so that was your thing. I wanted to tell you, like, don't abandon the original goal of the MSW MPA degree. Like, I love that you're working on that simultaneously while you're working in your 9 to 5. Because a lot of people just default to, I just need a degree or a certificate. No, what you need is real world hands-on experience, and you're doing that. What I would tell you to carry with you in your pockets, I know you said that you're focused on like grants and things like that, and to get money and things, you need to provide the people with data. But I would really encourage you to like, in order to achieve the goals that you want long term, I would say that make certain that you have strong systems in place for yourself to capture the outcomes of your work with the youth that you're doing now. Every little thing, the backpack drive, how many people came, or who did you go talk to at the school district to get them to pass out flyers. That's the other thing I would want you to really focus on too, is like developing strategic relationships with people. And if you decide I'm gonna stay where I live forever, I'm gonna build me a home or whatever the thing is, whatever the goal is, you need to then also make certain that at this time when you're working in your organization, that you're intentionally developing some strong relationships with people who have power and authority. Yeah, it's good to be cool with the teachers, but it's how can you get in front of the school superintendent, right? Just to even just inform them, not ask them for any assistance with anything, but just inform them of what you're doing, because you never know how that relationship can pay off for you in the long. All right. Thank you so much. You have a wonderful
Thank you.
day.
You too.
You're welcome.
Bye
Bye.
bye.
All right, so we are wrapped up with resume reviews and career makeovers. If you are watching this replay back and you have a question about anything that I shared on any of the last 3 sessions, it's been 3 sessions. We've been doing this for 3 hours almost at this point. You can just leave me a comment on Instagram. You can leave a comment down in the comment section. If you're watching on YouTube, you can leave a comment in the YouTube section. If you're listening to this anywhere else, you can just leave a comment or email me at mp@marthiapitts.com. If you want to work with me inside of the Micro to Macro Career Accelerator, I'm gearing up in preparation for enrollment in the next cohort of the Micro to Macro Career Accelerator, which is my 3-month group career coaching program. Make certain that you're on my email list so you can you can receive notifications of when registration opens. If you want to join the wait list, you can do that at macroandpaid.com. Join the wait list. You can actually meet with me, discuss your individual needs for career coaching, and you'll get an invite to the current cohort's weekly coaching call so you can see what it's like inside of the community. So visit macroandpaid.com and join the wait list. And until the next time, happy macro career planning.